This is Frequency, a production of the American Academy of Otolaryngology, Head and Neck Surgery.
Hello everyone, my name is Maria Serna. I'm an otolaryngologist and head and neck surgeon at Weill Cornell Medicine, New York Presbyterian Hospital in New York City. And I'd like to welcome you to episode 16 of the Academy COVID-19 podcast series. In this podcast, I have a privilege to gather together a panel of colleagues from across the globe, and we'll hear about their experiences during the COVID-19 pandemic and how it has affected them, their lives, their countries, their families, colleagues in hospitals, etc. I'm honored to be joined today by a wonderful international panel as we bring together otolaryngology from around the world to combat the COVID-19 pandemic. I'd like to introduce my panelists. Dr. Hossein Abdulrahman Al-Ran, who is a past president of Emirates Otolaryngology and Head and Neck Society. He's an assistant undersecretary and chairman of the International Committee of the Implementation of Provision of International Health Regulations and Prevention of Pandemic for the Ministry of Health in Dubai, United Emirates. Next panelist is Dr. Clemens Heiser, who is a professor and head of sleep laboratory in the Department of Otolaryngology and Head and Neck Surgery at Technical University of Munich in Munich, Germany. Dr. Marco Aurelia Safadi, who is a pediatric infectious disease specialist. He's the chairman of the Department of Infectious Diseases in Brazilian Society of Pediatrics, and he's also pediatric division head in Santa Casa Medical School in Sao Paulo, Brazil. Dr. Yulai Xu, who's an otolaryngologist and scientist at the Department of Otolaryngology at the Eye, Ear, Nose, and Throat Hospital in Shanghai Medical Center at Fudan University in Shanghai, China. And Dr. Claudio Vicini, who is the past president of Otolaryngology Society of Italy, and who's the chief of Head and Neck Department of University of Bologna and Ferrara in Romagna in Forlì, Italy. So before we go into the details and discussion about your experiences, I want to give everyone a chance to share with our listeners your background, and if you have any special involvement that within this COVID pandemic, and if you had any roles or assignments that were implemented during this time, I would like to hear that. So I will start with Dr. Hossein, please.
Good morning, good afternoon, and good evening for everybody, in whatever place you are. And happy to see all of you during this video conference. Of course, in United Arab Emirates, we have diagnosed the first case of COVID at 29th January 2020. So it was a family coming from Wuhan, China, visited as a tourist to Dubai, and they have developed the symptom. So that was the first time, on first day, we diagnosed a case with a PCR, of course, test. And we isolate the case. We have seen the contact tracing with the epidemiology, and we put them in isolation in the ICU. The cases was stable, actually. So just we gave them symptomatic treatment. At that time, nobody says, or we don't have the knowledge what to start with medication. So it was only symptom, fever, cough. So we have only treated the symptom and fever. And then we have conducted the national plan. We do have a national plan for pandemic. So we have conducted the national plan within the country to illustrate what is COVID, what is the complication, what is these things between the media, between the all the citizens. And from 29th January, then the cases started to increase. In March 25th, we have, of course, banned the airlines with all countries. And also we took all the preventive measure within our all hospitals because the cases started to increase. Some cases was coming from Europe, some cases was coming from Iran, of course cases coming from China. So we have dealt with the cases, and of course, some of the cases were only simple with no, even sometimes no symptoms. But from the otolaryngology practice, we have reduced the practice from March, where we have done only the emergency cases for the operation, and even outpatient, we have done it through the telemedicine. Any patients have complained, they can conduct by telemedicine and contact the physicians. We have certain centers where they can answer, they prescribe the medication, and the patient can take the medication from the pharmacies. Still, the number of the cases going on in my country, and we didn't reach the peak, or we didn't bend the curve till now in United Arab Emirates. But we are dealing with most of the cases. Of course, there is some of the cases which they have comorbid diseases like diabetes, heart disease, kidney functions. They have passed away. But still, we didn't reach and bend the curve in United Arab Emirates. This is which I can see as a short.
Dr. Hussein, what was your involvement during this pandemic? Because I know you've been kind of chairing this. I just want to kind of hear a little bit more how you personally been.
I worked in both. I worked as a managerial, where we conducted the epidemic plans for the country, and we do the epidemiology sites, as well as I have worked in the hospital where I helped patients where needed intubations, where need, of course, we wear the N95, we wear the PPE full for all the physicians as well as the nurses, which are in the front line in the treatments in the whole country.
I'm going in alphabetical order. So, Dr. Heiser, could you share your experience and like kind of a little bit more your background and how you were involved within this, if you were any special roles, and tell us a little bit more about yourself.
Good morning, good afternoon, good evening, everybody. Yeah, great honor for me to participate in this meeting. And I'm from Munich, actually, in Germany, and it's in the southern part of Germany. So we had the first COVID patients over here in our country, in Germany. I think it was just Italy and France probably a little bit earlier. You had more going on, or earlier going on, instead of us, because a lot of people were still skiing in the Alps and in the northern part of Italy, and they brought back this virus. One of the problems was the first case took place in a company here next to Munich. So 30 people were affected, and actually the government reacted pretty good, because what they did, they isolated all of these infected patients into one hospital. So everything was fine. So we had then a slowdown. We didn't hear for 2 or 3 weeks anything, but the border, everything was still open in Europe. And this was one probably of the problems, because people still went skiing in the beginning of March to Austria and also to the northern part of Italy, and they brought back the virus. And what we started to do in my own hospital, where I got involved, was during the mid of March. We shut down everything. So every surgery, just except emergencies like tumor surgery or any bleeding or whatever, we were still doing, but everything else was closed down. Also, we forbid any visitors to come into the clinic. There was just one entrance still open, where everybody had to get registered, get a mask, and had to disinfect his hands. And people have to fill in a questionnaire. I think this is pretty common right now over the whole world, where they have to say where they have been in the last 2 weeks. And in the beginning, when the people came from Austria or from Italy or France or somewhere else in some hot spots in Germany, they were not allowed to come into the hospital. I'm also running the sleep lab over here, and we also stopped everything regarding sleep. So we had to shut down the whole procedures over here, and we started to build up security for the physicians on the one hand, and also for our residents and patients on the other hand. So what we got were one of these helmets, because we got a lot of 3M, because we had a lot of patients on our ICU. So for Germany, we had more than 50 patients involved in the ICU, where we had to do a tracheostomy. And these helmets we were using for doing the tracheostomy in these patients. And still, we are slowly now starting to increase our normal program, but still we have a lot of protection like FFP2 mask, you have to wear glasses, so you wear double gloves, and I think what everybody probably does in the whole world.
Thank you, Dr. Heiser. Dr. Safadi, I will go next to you. If you could give us a little bit of background about yourself and your country and initial reaction to the pandemic.
Well, actually, hello. Thank you for the opportunity to share our experience here in Brazil. I'm based in São Paulo. São Paulo is the largest city in the southern hemisphere. We have in the largest São Paulo like almost 20 million inhabitants. And I'm the head of the pediatric department. I'm a pediatric infectious disease specialist. So we are really involved in clinical trials in children. My hospital, the hospital I work is like a large public hospital, is like a teaching hospital. So we have all the structure and it's a quaternary hospital. As you probably know, Brazil is one of the most heated countries currently. We have yesterday like 250,000 confirmed cases so far, with 16,000 deaths. So currently we are only behind the US in number of daily deaths associated with coronavirus. And I must say that we definitely have an underestimate of our situation. One of the main issues here in Brazil, once we started to detect cases, is that we were not able to really test patients as we should have been doing. We have a lack of supply of virological tests, so we are not able to test cases in the outpatient patient setting. We were only able to test patients that were hospitalized. So when you look the number of cases that Brazil is reporting, currently 250,000, based on our seroprevalence studies we have been doing, we are probably confirming one case, and for each case we confirm, we probably have 20 other cases in our country. So the current scenario is definitely really, the current scenario is an underestimation of the burden of disease here in Brazil. Regarding children, we are doing some seroprevalence studies and also prevalence of infection, taking in account that children usually have mild or asymptomatic cases. We were really looking at the role of children in transmission, which is something yet not clearly understood. So we were doing some studies to see the rate of infection in asymptomatic children comparing to children with influenza-like illness that come to our setting. And we are also looking at the infection among healthcare workers in our hospital. And I must say that in the last week, the positivity rate among symptomatic healthcare workers were around 45%. So each two symptomatic healthcare workers we test, one of them was infected with SARS-CoV-2. We still are in a different situation comparing to Europe. We are still seeing an increasing number of cases, so we haven't reached yet the peak of cases. São Paulo is probably the epicenter of the coronavirus pandemic in the Americas, together with New York. We are the two cities with the higher number of cases. And I think New York now is probably ahead of us, so we are still seeing an increasing number of cases. Just to share with you, since the pediatric department was not really under pressure, we were helping our clinical colleagues working in the ICU and also attending patients to see. And probably we'll have opportunity to discuss something that has been reported in Europe, initially in UK, then in France, in Italy, and now in New York. I know you have more than a couple of hundred of children with these inflammatory response, and we are also seeing cases associated with COVID-19, huge inflammatory responses of children and adolescents, and we can share it later after the other colleagues. So I will stop here to hear the others' experiences. Thank you.
Thank you, Dr. Sapadi. Dr. Xu, I'll let you share a little bit your experience, because we all hear about Wuhan and Hubei province and what's been going on there as a kind of initial start. And China was one of the first countries that had to react to pandemic. And you're from Shanghai, and so we don't hear much about what's happening in the other parts of the China. And so obviously, initially, you probably had a lot of fears of creating a situation where you would have similar spread of the virus. So I would like to hear your thoughts in terms of like how your city has reacted, and what is your background, like what's your involvement with this epidemic?
Thank you for having me here. I'm Yulai Xu. I'm an attending doctor. I focus on otology and neurotology. So in the past 4 to 5 months, it's like a dream, you know. It's like because this pandemic changes our life, our works so much. I remember Wuhan, the Wuhan city locked down on January 23rd. The worst month is February in China, and then from March, the increase becomes slower, and then April to May, they increase our patients with COVID-19 less and less. Right now, still we tried to return to our normal life, but it's very hard for everybody, for the whole country. It still is very hard because Wuhan, just few days ago, there's still several new patients in Wuhan, and there are some patients in the in the very lost country, very close to Russia. We have many new patients there. And in Shanghai, the big cities in Shanghai, Beijing, and Guangzhou, Hong Kong, we still have many new patients from other countries. So we tried to open restaurant, to open the store, but sometimes they still close and open, close, open. Well, it is very hard for. So that's why I say it's just like a dream. It's just like a dream. Maybe it's not a dream. It's like a nightmare for everybody. Since the announcement of voice human-to-human transmission on January 20, our hospital, in response, our hospital quickly implemented a variety of protective strategies for our patients' care, including pre-appointments, screening, triaging, restriction of non-urgent clinic visit and surgeries. And we have telemedicine, and we also did a lot of work to have enough proper protection, PPE. So in our hospital, we don't have any doctors infected. So right now we gradually increased our outpatient appointments and then tumor-related surgery, and finally open elective surgery according to the pandemic situation. At present, our clinic and surgeries volume has returned to baseline. And in the February and the March, the 2 months, we had about 1/4 as many outpatient visits and 1/6 as many elective surgeries performed from compared to the last year. So we are getting, we are returning to our normal work, but it's very hard.
Dr. Vicini, I would like to get your perspective, like a little bit of your perspective in terms of what your situation has been and your background and your involvement with this pandemic. I know that a lot of cases were mostly in the north, and the spread south was not as significant. And kind of give us a little bit of a background, like, you know, your thoughts on initial reaction and what is it that sort of prevented that from happening?
First of all, good morning, good afternoon, and good evening to all of you. Thanks especially to you, Maria. You could organize this great meeting, sharing, let us to share our experience with many friends. I'm happy to see the face just on the screen, just for now, this morning. Yes, Italy was one of the first countries in the world affected by virus. We had the first case at 18th of February. As you know, we were the unlucky pathfinder outside from China. So far, we had 225,000 cases overall in Italy, with 32,000 deaths. Our mortality rate in Italy was 14.5. That is a very high mortality rate. And during this period, we had a terrible lockdown of 67 days, from March 9 to May 18 or 25, according to the progressive activity. My area was more lucky. I live in the north. My area was a cold area between two very hot spots. That is Piacenza, very close to Lombardia, and Rimini. Rimini was a terrible place for the virus. We serve an area of 1.2 million of people with 5 ENT units. So we were definitely committed to serve for the virus. My department was canceled at the beginning of the story. We don't have anymore a true ENT department, but now we have ENT, thoracic surgery, and breast unit. My beds were originally 18. Now we have 1, 2, 3 beds available for ENT. So basically it disappeared. But I feel lucky because it wasn't converted into a COVID department. So we have just a sharing of the ward, but we have our beds and we can go on with our activity. That means only emergency and cancer. We have to spread our nurses to many other COVID departments in the hospital. And I have to define 4 doctors only for COVID tracheo team. We had a special team for that. Our offices were off, just open for emergency. Originally we have many OR sessions during the week. Now we have 1, 2, maybe 3 sessions a week for cancer and for emergency. For selecting cancer patients, we use the Chicago score that is very used everywhere for selecting patients for OR. And we have a multidisciplinary board deciding each for any single patient eligible for surgery. We spend many hours at home talking with the video call with patients. And we had a lot of discussion for reorganize our department, our activity at home. Again, about the personal protection devices. It was a main concern at the beginning because we had just surgical masks, no any other type of mask, no FFP2, no FFP3. We had, of course, glasses and plexiglass shield. And we use also snorkeling mask that we transformed to a PPD. Now is going better. Now we have FFP2, and so it's much easier to manage the patient. We are very close to reopen, very slowly and very cautiously, but we are reopening. But at the beginning, it was really, really tough. We have minimal access to serological test and to swab at the beginning. Now we have an increasing possibility to have access to this test. Anyway, if I look back, we had overall 2% of positivity in the general team, medical team in my hospital, 2%. We had positive just one ENT nurse, and no doctor was positive during the wave of the crisis. That was the general overview for us.
Thank you, Dr. Vicini. I want to get everybody's thoughts in terms of, well, maybe, or people who actually have experience with high volume of infections. And I want to hear some of the concerns that you might have and you've seen in terms of long-term complications from the patients who have recovered. And then also, what is the thoughts in the country regarding the reinfection with the virus, and as well as the role of the antibodies? Like, as we are doing more and more serologic testing, is it something that there's a big hope for, or most of the hope is going to still remain with the potential of the vaccine? I will start with Dr. Safadi, since you do have a lot of experience with infectious disease, and I'm just kind of curious to see what have you been seeing, and what are your specific thoughts, and how does your country, your department, going to implement care of patients in terms of long-term and in terms of testing moving forward?
Well, that's a very good question, and actually our experience is really limited. The circulation here in Brazil is more recent, so we don't have any real true long-term data among those patients, especially in children, since we have very limited severe cases in children so far. We have some bronchiolitis and some real severe presentations of bronchiolitis in children, but we're really limited number of cases. Interestingly, some of the children that we admitted with SARS-CoV-2 and severe respiratory syndrome were co-infections. So this is something that we are really looking at more in more details to see if there is any impact of having co-infections, I mean viral infection, influenza and SARS-CoV-2, respiratory syncytial virus and SARS-CoV-2. And so far we haven't seen any real differences in terms of severity of those cases. Very interestingly also, you know that we are in the peak of autumn here in the southern hemisphere, and this is usually the season of RSV. And for pediatricians, RSV is a real burden in our intensive unit cares, in our hospitals. So we usually see a lot of cases of children being hospitalized. And this year, for the first time since I'm a pediatrician, and I'm a pediatrician for quite a long time, I haven't seen my hospital with children with RSV. So a huge decrease in the season of RSV, probably due to the quarantine and the isolation that have been imposed here in São Paulo, and schools were closed, daycare centers were closed. So if we don't know actually the real impact on the COVID-19, we definitely know that it impacts on RSV and also in influenza, because we have seen a very mild influenza season here in Brazil. We do surveillance routinely for all children with severe respiratory syndrome for quite a long time. And the situation this year is completely different. So SARS-CoV-2 took the protagonism of all his respiratory infections and left RSV and influenza as very mild seasons, and probably you have a different situation in Northern Hemisphere. You are going to see in the end of the year, and let's see what happened in your region. But specifically to your question, Maria, in terms of long-term complications, we are still looking, and I have no data to share. One interesting point regarding immune responses is that most of the children that develop mild symptoms, mild presentations, we are not seeing a seroconversion rate as we would expect. So despite having the diagnosis done by PCR, by RT-PCR, so we definitely know that they were infected. Most of the mild presentations, we have a huge false negative seropositivity, both for ELISA and for the chemiluminescence. So we definitely need better serological tests, because the current serological tests we have so far, my impression is that they are prone to have really high false negative results, especially among mild and asymptomatic patients. And I'm very curious to see what the colleagues from Europe and all over the world and in the US have regarding this specific point. We haven't had any single case, a reliable, unequivocal case of reinfection. So this is something interesting that we'll still have to follow up. But if you look at the other two coronavirus, zoonotic coronavirus, SARS-CoV-1 and MERS, at least for 2 or 3 years after being infected, those patients were protected against symptomatic reinfection. And we have so far some trials in non-human primates that were infected, and then after a couple of weeks they were challenged with the virus, and none of them become symptomatic with disease. So just my impression, just based on anecdotal reports and personal opinion, I don't think that we will see symptomatic reinfection, at least immediately after the infection. I mean, short-term protection is something that I expect among those infected patients.
Thank you. Dr. Vicini, I want to hear your thoughts on that, because you also had very high numbers of infections and deaths, and you've been dealing with, your country's been dealing with this a little bit longer than the rest of the world. What are your thoughts in terms of reinfection rates, benefit of serologic testing and having the antibodies, as well as long-term complications?
2 points. For the recurrence, is not so common as was defined in different countries. I don't know if the reason is the so strict and so long lockdown. So the movement of the virus in my country was limited by very strict lockdown. So we don't have a lot of patients with recurrence. We have a lot of patients with what I call the dance of positive and negative swab. It probably happens everywhere in the world, because of course the sensitivity is not so high. False negative is very common. I feel the same as a colleague in Brazil. We had the same skepticism about the serological test available so far. The finger test and ELISA as well doesn't work so well as expected. So we are working against the master with very poor tools in terms of swab and serological devices. I know that you in your country, you have a highest level of serological tests. They are not available in my country. So we are working just with finger test, ELISA, and swab. But it doesn't work in a very precise way. So what I feel is that we need a better tool in order to face the problem. Thank you, Maria.
Dr. Xu, could you comment on what are anticipated progress in China, and if you have been seeing any long-term complications, and what are the implications of serologic testing for country moving forward, and especially regarding the infection rates?
In Wuhan, so probably in Wuhan, everybody, you can imagine Wuhan is a big city. It's almost 10 million people. Everybody needs to have tests, and in hospital, everybody, all the patients admitted to hospital. I mean, inpatients, everybody need to have tests. So that makes us very well, a lot of work to do, and it make patients a lot of work to do, extra work to do. But in China, the government is very strict. Lockdown is very, very strict in the beginning. For Wuhan, it's very strict. That's why we controlled. We actually in China, I think to some degree, the COVID-19 is under control to some degree, but we still the government, hospital, and they reopen very slowly and very carefully. I think that's but we have to reopen. It's almost 4 to 5 months. So that's my part of comments. Thank you.
Dr. Heiser, I know that Germany's been testing people early on, and there was a lot of testing done. And knowing that the death rates in the country were relatively low compared to some other parts of the world. And could you comment a little bit more in terms of like, how do patients feel? Like, do patients feel scared? Do they have any concerns about coming back to the hospitals and having normal lives, and whether that broad availability of testing actually was helpful, and what are your implications again in terms of serologic testing, and how do you make patients and your workers and staff feel comfortable to come back, to return to activities, to come back to surgical procedures?
Okay, yeah. In the beginning, it was, I think, for a lot of patients, when we shut everything down, the hospital looked like a ghost house. Yeah, there was nobody walking on the floors where it's normally very crowded, where a lot of visitors come in to visit the patients, and people in the beginning definitely were afraid of coming to the hospital. But we really start very, very early to test as much as we can in the hospital. So every patient got tested who come into the hospital. Yeah. Now we are also doing the antibodies, but we are not sure if we really can trust the antibodies, because we tested all the workers in the hospital. So 6,000 people in our hospital got tested, and almost no one is infected or was infected. So that's a kind of why we are a little bit struggling, if there are different test kits, tools available. So we are not sure if our one is the best one. So this needs to be figured out. But there are also German companies like the Bosch company working on these test kits and made it available a few weeks ago. So we have to wait. But regarding the patients now, it's the same like if you go out of the hospital. So everybody in the beginning was afraid, but now the weather is getting very nice, and people want to go out because they were shut down for 6 or 8 weeks. They had to stay at home. So everybody is getting more and more relaxed. So people who are coming to the hospital, or the patients who are coming to the hospital, feel more secure, because still we are having this very, very high security over here. So still every patient who is getting surgery or any diagnostic gets screened for COVID. So this probably helps us to get our patients back, or that they really feel secure. I think probably there is no more secure place in the whole world, like a hospital where you can do all this hygiene, right? If you go to a supermarket where people are not probably know how to deal with these situations, yeah, and probably disinfection is not everywhere available like in a hospital, I think the hospital is probably the most secure place, at least in Germany right now, where you can be.
Thank you. Dr. Hussein, I want to hear what the strategy that is going to be implemented moving forward, because Dubai has been like basically international hub for, it's a very big international place, and there's so many connections through like basically connecting the entire world, and I could easily imagine how Dubai could have basically turned into New York. And so the question that I have, like, and I know that there's everything, a lot of like significant lockdown strategies are implemented right now. But in terms of not maybe even comment, not in just from the United Emirates perspective, but the whole region of the Middle East, like, you know, what are the thoughts in terms of making people feel comfortable again in terms of testing, and what's the availability of those resources?
As I said before, the shutdown of the airlines, of everything in the country has affected the country strongly in the economy, as well as the tourists. But now we started the shopping malls to open them slowly by taking the measure of wearing the mask, social distance, and that is growing slowly. Regarding the airlines, I think by end of June, the government have putting a plan to start the airlines with some, not all the world, but some countries. But there will be a lot of restriction, like, as I heard, only it will be occupied by 40% of the airplane, not full occupied, to start with. As you know, it depends also on the receiving country, if they will allow the passenger to come there. And regarding the test, now we are depending more on the PCR, because ELISA and IgE is not functioning well. We have tried a lot of them, and even we tried for some of the labor who was going to one of the Pakistan. But when we done for them, it shows negative. But when we done for them, PCR came positive. So we are not depending on IgE or ELISA for the time being. Maybe in the future something else will come, as other colleagues did. But the airlines, I think the government are putting a plan to start aviation by end of June. It depends, of course, on the agreement with other countries and how it will be function. But of course, the economy is affected, the tourist is affected, all the hotels which you used to see a lot of population there, a lot of people, a lot of activity is empty, actually. So we hope we overcome all these situations.
Yeah, that's a challenge for, I mean, I'm in New York City. Like this has affected New York tremendously. I mean, the whole, there's like really everything is shut down. Like there's streets are empty, and again, the hospitals were overwhelmed with patients with COVID, and the biggest challenge was just to try to.
As this virus have affected all the world, not even a small country or a rich, it has affected all the world.
Yeah.
Really.
Okay. I want to hear like a kind of a one sort of sentence from each one of you regarding what was the biggest challenge you think that was in this COVID pandemic for you specifically in your country, and then what one strategy you think made the hugest difference in terms of preventing the spread of infection, fighting the virus?
I would say from my challenge for my country, some cases have died, but we don't know exactly what was the case, what was the cause of death. Till now, we are investigating, because all of a sudden, respiratory distress happened. It was stable. All of a sudden, respiratory distress, even you cannot do the intubation, you cannot take that. And I think by time we can overcome this lockdown and the virus, and life will go on. This is
Dr. Vicini, what's your perspective in terms of biggest challenge and the best strategy that worked in this pandemic?
For my side and for my area, for my department, for ENTs of my area, the problem were two big challenges. The challenge number one was to get a slot for surgery. We have to fight every day for organize 1, 2, maybe 3 cancer patients, because we have to fight against all the other doctors, anesthesiologists, the board, for searching for a bed and so on. But the real tragedy, I use the term tragedy, was the in cooperation, not coordination between our government, our Minister of Health, the Minister of Health of our area, because healthcare in Italy is not in one area, but is spread in all the regions. And inside the regions, we had what we call Unità Sanitaria Locale. That is another organization that in my area includes 4 big hospitals. All of them were used to work without talk each with the other. So the teaching of that we have to do mostly by ourselves. Now we are ready for everything, but we didn't receive the sufficient help from the top. So we used to do is to learn by ourselves, to learn from our colleague in Lombardia, maybe from outside, and to apply. That was the most important issue, the most important lesson for us.
Dr. Safadi.
Yeah, thank you, Maria. And if you allow me, I would just before answering and addressing this question, just highlight a point that I missed in the last part, which is the question regarding reinfection. And just to share with you that so far, the main challenges we face it here, at least in Brazil, as you know, Brazil is a continental country, and we have a lot of disparities among our population, unfortunately. So the disease is now among the poor areas of the country, and they have very limited resources, very limited availability of intensive care unit beds in some regions from Brazil. And unfortunately, we are also facing a huge disease of the current era, which is named fake news. And fake news really does affect the pandemic. So we don't have to face only the virus, but we also have to do and to deal with fake news and politicians that instead of helping us to really tackle the virus, the politicians started to very dissonant messages. And as our colleague from the Arab Emirates told, the economy is hugely affected. We know that, but so far we don't have vaccines, we don't have antivirals, so we have to rely on hygiene, use of masks, and isolation. And for the isolation, we have to have a clear message from our politicians in order to have them really being obeyed. And so far, unfortunately, in Brazil, we don't have this kind of message. So this is the big issue we are currently facing besides the virus. Thank you.
Well, Dr. Kaiser, would you make a comment on your biggest challenge in the country, and what was the best strategy that you think was helpful to fight?
I think the biggest challenge is because people, now the weather is getting better, so it's summertime, and the people are getting a little bit tired of all these security things which we did in the last few weeks or months. Yeah, especially if I look at my residents, to put all the gloves on, to put the masks on, to do the ENT examination as we do it every day, it takes so much more time. And to be honest, it's really, yeah, you don't want to really do it, and probably we will have to do it till the end of the year. But that's the same if you go out, right? If you go, like Munich is very famous for its beer gardens. So if you now, they started to reopen the beer gardens yesterday, but you have to do like a check-in, you have to sign something. A waitress is bringing you to a table, so your neighbor is like 2 meters far away from you. This takes all the feeling. And I'm a little bit afraid of that the people that they are getting bored of it, that they don't, because all of the fake news, as we already mentioned it, that people will probably getting lazy about this security. This security is so much important because this is one of the reasons why Germany probably did such a great job during this pandemic season, because we were taking pretty fast, pretty well care on all of these things. So this is what I'm most afraid of.
This will be my last question because we're coming up to, like, you know, almost an hour of the discussion. But I want to hear from all of you, what is the change in your practice that has been implemented and you think is going to stay there going forward? And I'll start with Dr. Hussein.
The change, of course, there is a feel from the patients to come to the clinics. But by time, I think when now they realize the conditions of the cases is slightly grown more, they will be having confidence to come back. And we assure them, we must, as a physician, assure these patients that they are in a safe hand. This is which I would say.
What about Dr. Safadi? What changes do you think that's been implemented that are going to stay and probably with us forever? I think, like, you know, as you mentioned yourself, one of the interesting things that you mentioned that this strategies that are being implemented right now are not just fighting COVID, but fighting other illnesses as well, which is very, very good point. So would you make a comment, especially from the infectious disease standpoint, like, you know, what you think is going to be with us forever?
Thank you, Maria, and it was a very nice experience sharing and listening and learning with our colleagues from all over the world. It was really nice. Two points I think I would like to stress at this point. The first one is exactly what you mentioned. I think that we are now moving to a different behavior. So I think people understand now the importance of hygiene. So we will probably see an impact on other infectious diseases. So once you frequently wash your hands, once you frequently have more hygiene habits, you will also see a decrease in other infectious diseases like diseases from the oral fecal transmission. We'll probably see decrease in rotavirus disease, in norovirus disease, in influenza, in RSV. And once these habits are really incorporated, I think that will be something, a good legacy from this pandemic. Another thing that we are seeing in Brazil, and probably my colleagues are also seeing, is telemedicine. So consultation by web and classes by web, discussions by web, the way we are doing now with something new. Probably most of our congresses and meetings of societies will probably be done via web in the future. So I think this is another, let's say, legacy from this pandemic. I think these are the two things I mostly see as probably that will be incorporated in our day-by-day habits. Thank you, Maria. Thank you to our colleagues. It was really a pleasure being all of you. Thank you.
Thank you so much. Thank you. It was a pleasure. Dr. Vicini, I would like to hear what you have to say in terms of like implementation of permanent changes.
My feeling is the challenge will be to restore the original activity. As you know, ENT activity is very busy. You have to take care of a lot of patients in a short time. But now it's not anymore possible as in the past, because we have to work in safety. And ENT is one of the more risky area of the medicine right now, because we have to face droplets, we have to inspect inside the nose, inside the throat. So we are trying to do our best in order to combining a new way for working in safety, but taking care of more and more patients as usual we used to do in the past. Telemedicine is one of the new tool that we will have available. We learn to use at the best. Another way we try to develop new tools for new mask, more easy, new system for protecting doctor during fiber optics. That is one of the most risky operation that we do. But I feel that in about 2-3 weeks, we will be able to take care of almost of the same number of a patient that in the past. So I am optimistic about that.
Dr. Xu, would you make comments in terms of what was your biggest challenge with the pandemic, and then also what changes do you think are gonna be here to stay in your practice?
Yeah, and I think the biggest challenge is unknown, because the new virus is new virus. We don't know the new virus very much, and we don't know how long does it last. I mean, for the pandemic, so that it caused a lot of fear. So that's the challenge, and the big change is for us is right now we need to see patients much slower than before, and we wear a lot more PPE, and yeah, it's a safety concern. So that's the big change, and also the change is for our own life. For the whole world, I think there's a lot of fear. So we need to figure out how to fight not only virus but also fear. So we hope the vaccine or treatment get work very soon. Thank you, Maria, and thank you, everybody. I hope we can see in person AO maybe this year or next year.
Yeah, we hope. Dr. Heiser, I would like to hear your comment in terms of what changes do you think are going to be implemented moving forward in the practice?
Yeah, I think probably this crisis is probably a big change for a big change for us to change probably a few things. Look how, if we think of all the physicians, how many webinars we did in the last few weeks or last 2 months, how the world, at least in regarding the physicians, got so much well connected, the different ENT parts of the world, and also the sleep physicians over here. So I think this is probably the chance we can get out of this pandemic season. Also, probably a lot of people start to think what is important in life, right? What really counts or what does not count. So I think this will probably change a little bit the society and a lot of people how they think. At the end, probably our working day will be probably a little bit less stressful, because we won't have the chance probably again to see so many patients in 1 hour as we did before, because of all the hygiene we have to take. But this is something which we are probably hoping for, but let's see. I think this pandemic is definitely a chance for us to change a few things.
I would like to thank all of the participants for sharing your experiences. Thank you to all of the listeners for joining our podcast. I'd like to remind you to continue to visit COVID-19 resource page at ent.org, and also join our conversation at ENT Connect, where we're sharing information and inspiration as we get through this time together. And now we're all around the globe. As always, we are one. Thank you.
This has been Frequency, a production of the American Academy of Otolaryngology, Head and Neck Surgery. To download more episodes and our mobile app, please visit our website at entnet.org/frequency. That's FREQUENTCY.